Speaker.
Member for Warren Westwood.
Thanks, Acting Speaker. So my grievance today is to the Minister for Mental Health, and I thank the Minister for taking this grievance. And it largely refers to two programs in the southwest that, in their respective areas, deliver early intervention and preventative strategies in and around health as it applies to youth, and in particular to mental health. The two programs, firstly in regard to the Parenting Support Program, it's a 2-year pilot program and supports approximately 140 families in the southwest region, and unless it's actually refunded by the WA Country Health Services, it's due to conclude in March 2020, so March next year. It provides free home-based intensive parenting support to families referred to by a child health nurse. And of course the aim of the program is to support families with young children aged 0 to 5, so the very young years, to successfully achieve all significant health and developmental milestones and to be ready for school. The program addresses a range of concerns in respect to nutrition, routines, behaviour, sleep, safety, and helps break the cycle of family dysfunction, and certainly has strong support from the southwest. Again, the program is run by GP down south. There's been a report on the program by Edith Cowan, an evaluation study in June 2018 to May 2019. It showed that they satisfactorily completed the KPIs in respect to their contractual obligations. It certainly represented value for money, and that it was likely to see a return on investment between $2 to $6 for every dollar invested in the program, and reported a unit cost per occasion of home visiting in the low to mid-range when compared with comparative international data. One of the challenges, Minister, is that the submission for funding is there now. WACS is waiting for a second report, which is due in January next year. The challenge is that because of the timing of the program, we have a timing issue emerging. The capacity that's in place now to deliver the program is likely to be decommissioned, and the challenge is nothing's quite lining up well. So the request there is to ask for your intervention to expedite the application process so there can be some security in and around the funding to ensure that that program can continue. And of course it has wide support to significant numbers of families, and the early intervention approach is something I think to be lauded. The other program that's in a submission from GP down south is the 3-tier youth mental health program. Even in today's paper there's an article talking about the challenges of mental health across our community, making specific reference to youth mental health. This program is early intervention and preventative, targeting years 10 to 12 in schools throughout the southwest. Tier 1 being an approach to mental health and wellbeing awareness, so building awareness amongst young kids. Tier 2, prevention and coping strategies, engaging secondary school students in discussion of healthy and unhealthy behaviours, specifically stress, drugs, alcohol, body image, peer pressure, mental health, all those things that we know are attached to the mental health challenge. And Tier 3 is intervention and direct support and services, providing a more individualised counselling and mental health support, targeting those young kids that require that particular service. So the program supports a service gap that is not delivered by any other program down there, and I think this is a really important point. Early intervention, targeting in schools, the mental health challenge is very real. That approach has been really well received. A number of indications of support have come here from letters from the Northcliffe District High School, from the Boyup Brook District High School, from the Nannup District High School, from Manjimup Senior High School, from GPs in the southwest, and this one from a GP from Bridgetown, WA Primary Health Alliance, and also from community nurses that are involved with Manjimup, Bridgetown, Nannup and Boyup Brook School. So strong support from the broader education community in the southwest. It fills a gap. We know that intervention at a school level is so critical to developing the awareness in mental health and acknowledging the challenges that they are going to face, setting them up to be confident to tackle these services and be a part of the services that are there to be able to help them through those issues. Again, this is due to finish up at the end of the year, and there's a level of capacity that sits out there that I think is really important to maintain. Minister, I do note that your government, the McGowan government, took to the 2017 election a commitment in respect to 3-tier youth mental health programs in the Peel region, and that's I think running running for a period of 3 years from memory, for the 3 years 2018 to 2020. I know that it's well received in that region. Again, applying that to the southwest, given that it's been respected and acknowledged in terms of the services it delivers to a cohort that's important from the point of view of early intervention and prevention of the challenges coming to light. So, Minister, these two programs are the basis of submissions from GP down south. They have a lot of groups that are delivering those services that are well established, supported by the general practice network in the southwest, most importantly supported by schools, having the opportunities for schools engaged in the challenges that our youth are facing that will be identified in later years is really important, because, and I know it's one of the toughest decisions when you put this sort of stuff to Cabinet, when you get your, I think it's a yellow sheet or whatever it is that comes from Treasury that says, give us some indication that this is going to be investment that's worthwhile. Anything that goes into the preventative space is difficult. And one of the big sleepers that sits out in our community is mental health. I think that's well recognised across the board. These strategies, particularly the ones that are showing good outcomes and have broader support from all the respective groups that are impacted within our community, not only the target families and the target kids, but also the schools and those that are engaged on the battlefront of dealing with mental health from a broader community perspective. So, Minister, we've got little cliff faces coming with funding on these. They aren't significant amounts. The southwest is a little hotspot for this. Your intervention to give some surety of those funds going forward will be really well received. And I ask this in genuine support of those that have made representation to me to be able to put this on the agenda. And I know I've also made representation to your colleagues in the upper house in the southwest, particularly the member, the Honourable Adele Farina. So, Minister, I seek your support.
Acting Speaker, I'd like to first of all thank the member for bringing this grievance this morning. It provides us with another opportunity to all of us, I think, recognise just how important youth mental health and those early years physical health is in relation to the overall well-being of our community. So I want to commend the member for sharing the government's passion for this particular area, but also to provide an opportunity just to acknowledge the great services provided by the not-for-profit or non-government sector in relation to a lot of these community-based programs. And I'm familiar with GP down south and the other organisations that do great work both in the members area but throughout the community. And it's a good opportunity to just take another pause to acknowledge them. And certainly, and member, I might deal with these because one actually comes from my mental health portfolio, one from my health portfolio. So I'll deal with them separately, although I acknowledge that GP down south is inextricably linked with both of them. And certainly in July 2017, the pilot three-tier youth mental health program was launched with GP down south receiving a 3-year funding component in relation to that, and the Mental Health Commission will shortly commence its internal evaluation of the 3-tier youth mental health program pilot project to assess the outcomes achieved. Any further funding will be considered in line with the Mental Health Commission funding priorities and the outcome of the evaluation process. So, as you observed, member, that would come to an end in July 2019, and so that of the future, the next budget cycle represents an opportunity to basically reinvest in that process following that evaluation exercise. And the Mental Health Commission purchases similar services for students in schools in Perth, Acting Speaker, Metropolitan and South West, including $900,000 to Youth Focus to provide education, counselling and support activities as part of the school's response program, and more than $573,000 for face-to-face counselling services for young people and their families. This is all part of the $10 million budget that we have at the Mental Health Commission for non-government organisations and other mental health and alcohol and other drug services in the southwest region. So it's an area of significant activity for the Mental Health Commission. You understand more than anyone, I suspect, member, just the difficulties of isolation for young people with mental health issues, and in your area in particular, where people live, potentially live in more isolated lives. It's an important issue that we stay on top of. As I said, we will continue to evaluate that program, and I'm looking forward to the opportunity to engage not only with the Mental Health Commission but the service providers to get that feedback and evaluation, so we can potentially make a strong bid in the next budget cycle. The other area, Acting Speaker, that the member raised was the parenting support services through the child health services in the southwest, which are provided by WACS child health clinics, and currently also by the Southwest Aboriginal Health Service. Now, this is part of a more complex process where previously we funded these through a grant program, and we're now transitioning to a service agreement program. So you expressed some concerns that in the event that grant to the GP down south, if that's not renewed in March 2020, well, then there would be no service. The South West Aboriginal Medical Service will still continue to be the service provider in relation to that, but of course this doesn't detract from the great work that GP down south are doing as part of their pilot program under the grant process. For members' information, Acting Speaker, typically the parenting support services is a more intensive parenting support above and beyond that offered by the Universal Child Health Check system. Vulnerable children and their families identified by WACS Southwest and SWAMS are successfully referred to PSP, and the support that families receive are tailored to individual family needs and can involve a combination of in-home visiting and phone support to support families in a range of areas, including sleep, feeding, nutrition, children's behaviour, parenting skills, toileting, routine, readiness for school, and building support networks. And as the member rightly pointed out, this is an important focus that we want to make sure our kids meet the developmental milestones, and that's why it's part of the Premier's priority targets to support kids in that process. Now, initially, PSP funds were allocated through a grant agreement to GP down south to deliver the Universal Child Health Contact Schedule. This grant expired in 30th of December 2017 and was extended to March 2020. In 2018, WACS transitioned from grant agreements to service agreements to meet the requirements of delivering these community services in partnership policy, and service agreements were awarded to organisations that had existing grant agreements and met performance requirements. Now, as the member observed, Acting Speaker, the program run by GP down south has currently been evaluated. I think you gave us some of the early indications of the success they're having. That is also now they're combining with WACS to undertake a deep dive in terms of the work that's been done. So I'm looking forward to receiving a report very shortly from the WA Country Health Service with regards to the effectiveness of that. On October 2019, GP down south provided the evaluation report to WACS, and the report concluded that further evaluation using a goal attainment scale was required, which GP down south indicated would be provided by to WACS by January 2020. So it is, we are coming down to, push is coming to shove, member, I think is perhaps the best way to describe it. But we will continue to work with GP down south just to make sure that, one, we've got that assurance that the program is meeting its requirements. It is part of a pilot project, so there are, we do have to identify future funds, but I'm very prepared to meet with GP down south and with WACS to see if there's a way through.